Well, I think we'll go ahead and get started. Welcome to our Social Impact Fund Town Hall. I really appreciate that you are all making the time to be here with us. We are very excited to be talking about the Social Impact Fund here in the Twin Cities. I'm Holly Messick. I am the Executive Director for the American Heart Association here in Minnesota. And it's just been such a pleasure to really be talking about what is possible when we fund opportunities through the Social Impact Fund. So couldn't be more thrilled to be having this discussion today. I wanted to just share a little bit about the American Heart Association. You know, as an organization, we've been around for almost 100 years. And really, our mission has expanded to be a relentless force for a world of longer, healthier lives, and a strong focus on health equity, really to make sure that health is an opportunity for everyone, no matter who you are or where you live. And the Social Impact Fund is just another way for us to put our mission into real action in this community, and such an important time for the Twin Cities. So we're so inspired to be doing this today. So before we begin, I wanted to walk through the agenda real quickly, just to let you know what this hour is going to be all about, and then we'll get into more of it. So again, this is the Social Impact Fund Town Hall. Right after I walk through the agenda, we're going to have a short video from our national CEO, Nancy Brown. And then we're going to welcome on our Vice President of Health Strategies, Justin Bell, to share more about the impact we're making in the community, as well as what we're seeing in terms of need. And then we're going to open it up to all of you to share, to ask questions. And so when that time comes, you can put those in the chat. You can raise your hand to come off mute or on video, really up to you. We want to have that be really an interactive time to come together. And then Max Gritzuk, our portfolio manager for the Social Impact Fund, is going to come on and tell you all about the Social Impact Fund, answer your questions as you prepare your expressions of interest, and then we will close out. So a really jam-packed morning here, and we want to hear from you and really help you as you leave this conversation. Be ready to either submit your expression of interest or share it with others that you know would be great to do that. So thanks for being here, and now I will turn it over to our CEO, Nancy Brown, for a message.
The racial violence we have seen in our country is shocking, devastating, and heartbreaking. Breonna Taylor, George Floyd, Ahmaud Arbery, Jacob Blake. The list of Black Americans senselessly killed and injured goes on and has for far too many years. Our hearts go out to everyone who is grieving and searching for justice. The American Heart Association denounces these horrific acts. We value Black lives, and we stand with the millions of individuals and thousands of organizations in saying, enough is enough.
We know that heart disease, stroke, and other chronic health conditions afflict Black Americans disproportionately. Specifically and sadly, there are many health inequities African Americans have historically faced, including a lack of access to health care and insurance, and many socioeconomic barriers. Evidence shows that racial inequities negatively affect African Americans' mental and physical health. In fact, racism is associated with depression, anxiety, and other serious conditions. And the global pandemic has put a brighter spotlight on the fact that Black people and other people of color continue to face disproportionate illnesses and death from COVID-19.
As a science-based health organization dedicated to the health of all Americans, it is our duty to fight health inequities and the public health crisis that is racism. The American Heart Association has championed health equity for all people for nearly a century, and we are more determined than ever to eliminate racial and class disparities. We are redoubling our commitment to overcome barriers to health and address social inequities through science, through advocacy, and through our work in communities.
We must stand together as a relentless force for a world of longer, healthier lives. That is our mission, Helping to build an equitable society is essential to fulfill this important mission.
People are counting on us like never before. We will listen. We will drive change. We will be relentless.
Well, thanks everyone for joining us today. We're really excited to be able to talk about this unique opportunity a little bit. My name is Justin Bell. I'm the Vice President of Health Strategies for the American Heart Association here in the Twin Cities. Today there's going to be a few different times where you'll have a chance to talk to us and to share your thoughts and to ask questions. In a little bit, you'll have chances to ask Max about the program itself and the process for going forward for the Social Impact Fund. And just a few minutes after I get to share a little bit about what the Heart Association is doing around these areas, we'd like to hear from you. We'd like to hear about your thoughts, your experiences, your expertise about these three questions. So I wanted to give you a little preview of the questions so you can start thinking about them a little bit. The questions are, what are the most critical needs that you're seeing in our community around these areas that we're focusing on for the Social Impact Fund? So food insecurity, economic empowerment, housing insecurity, and closing that education and achievement gap. How do you think we should focus our funding to drive sustainable change in these areas? And what gaps are you seeing in coordination and funding for approaching these areas? So give those a little bit of thoughts, and then in a few minutes, we'll ask you all to sort of chime in. You can raise your hand in the bar at the bottom, or you can enter your question in the chat box, and we're excited to get your thoughts too. Next slide, please. So I want to talk a little bit about how the American Heart Association is already working in these areas and trying to set up for much bigger gains that we can leverage the Social Impact Fund for. When we talk about sort of our health and the reason that we're focusing on social determinants of health and these social risk factors, it's important to note that roughly 50 million people in the United States are at a higher risk for cardiovascular disease because they lack the most basic needs, including access to food, access to clean water and air, access to housing. And we know that only about 20% of our overall health is impacted by the quality and access of medical care that we get. The remaining 80% that has to do with social and economic factors, health barriers, physical environments. These are the things that we talk about and we mean when we say social determinants of health or social risk factors. These determinants are conditions in which everybody is born and they grow and they live and they work and they age. Research shows that life expectancy of two people living just 20 miles apart, even in our communities in the Twin Cities, can differ by as much as 20 years. And for far too long, these factors have disproportionately affected the poorest pockets in society, creating significant health disparities and health inequities. So that's why the AHA has doubled down on our commitment to addressing social determinants of health right here in our communities. Next slide, please. As we've narrowed down our focus for the next few years in the Twin Cities, we've really worked things down to 4 major categories, with a 5th one that we don't have any control over. So we've focused on these 4 areas with our opportunities: reducing risk for women, controlling blood pressure, improving healthy food access, and preventing and controlling tobacco and e-cigarette use. Now, because COVID-19 looms over everything that we do and all the communities that we work in, it's impossible not to include it as a 5th focus area. And most importantly, all the things that we do will be approaching these through a lens of health equity, really working to ensure that there's increased access and opportunity across all of these priorities for the most vulnerable pockets of populations in the Twin Cities. The Heart Association is going to take a holistic approach to our work, taking into account the social, environmental, and physical conditions that factor into success in each of these areas. We're going to be working on the ground in concert with our local partners to develop individualized action plans that'll make significant improvements for the betterment of our community. And I wanted to share, just sort of as some groundwork, just a few examples of some of the things that we've done in our new community impact model over the last couple of years in the Twin Cities to set up success. So just a few of these areas that we've worked on. The American Heart Association here in the Twin Cities led the charge in establishing the Good Food Access Fund in Minnesota, which establishes local grants to the Department of Agriculture for protecting and increasing access to healthy food in Minnesota's food deserts. The Heart Association's invested heavily in local tobacco policy work that goes well beyond the success of Tobacco 21, raising the sales age for buying tobacco, and really hammering home flavor restrictions, including menthol, that are targeting our communities of color and our youth and our local communities. We've also worked on tobacco work that works on zoning and licensing cap restrictions. The American Heart Association, when we had an opportunity to place 2 community blood pressure kiosks, we decided to take a different approach. The national best practices was to go for high population areas. And here in the Twin Cities, we decided instead to invest those kiosks into communities that had a particularly disproportionately high rate of hypertension. So we placed one of them at the Division of Indian Work in Minneapolis, and we placed the second one at the Hmong Village in St. Paul, really focusing on those communities and those populations and following up with programmatic work for hypertension and blood pressure control and healthy living. And just most recently, the American Heart Association in the Twin Cities has repurposed some funding that we had for projects that couldn't move forward because of COVID-19 to react to our local federally qualified health centers and some of the challenges that they're seeing in getting their patient populations through to the other side of this pandemic. So we've been able to substantially reinvest some of those funds directly to our local partners that are doing this work. Now, these are just a few examples of where the American Heart Association had resources and opportunity to act in these areas already, to directly impact these populations. The Social Impact Fund is going to allow us to support our community partners who have different skill sets and different expertise and really can help us address these issues and build upon this initial framework and groundwork that we started here in the Twin Cities and try to close some of these health equity gaps. Next slide, please. So here's where we'd like to hear from you. So if you want to enter a question in the chat box, or if you want to raise your hand and use the button bar on the bottom to raise your hand, we can take you off mute, and we'd love to hear from you about where you're seeing the biggest opportunities and the biggest challenges in these areas. So we'll open up the floor now to everybody.
Hi, Amy, you had a comment in the chat box. So I've asked you to come off mute if you don't mind expanding upon your comments.
Hi, Amy.
Oops. Hi, sorry about that. I
go.
thought I was unmuted, but I was not. Typical Zoom experience here. Thank you. Yeah, I just said that through our work at Appetite for Change, we see all of the above issues as intersecting and being challenges for all of the folks that we engage in our programs. We value our participants and those we engage in our programming as partners, and making sure that the experience is not just one of feeling of accessing charity, but also accessing an experience that really provides value and helps folks feel like they're participating in a system that anyone else can participate in who could, pay for that experience.
Thanks for that input, Amy. I'm wondering, well, first of all, is it even really a Zoom meeting if someone doesn't start talking on mute? I don't think that even counts. So I'm glad you got that out of the way right away. Are you seeing any experiences from your side of the work where we can make these more meaningful, where people, the populations we're trying to reach, feel like they have more buy-in like you're talking about? Oh, we may have lost Amy again. Maybe we took her off of mute.
No, I was all of a sudden not allowing me to unmute. No, I did. I think that, that's a tough question. I feel like organizations that are embedded in communities and have the relationships and that have members of the community on their leadership and board are really valuable in partnering and making sure to lift up that work, because that they offer a window into community members feeling that that's a trusted space and feeling that they can participate with other folks who they know and recognize and are familiar to them. So I would say that's a good place to start.
That's great. Thanks, Amy.
So we've got a couple folks commenting again in the chat box. I think Ann Gainey has come off of mute. If you'd like to discuss your comments further, Ann.
Sure. Hi, everybody. I work with the Minnesota Community Health Worker Alliance, and we see that, yes, the issues you've identified are huge. And while COVID hit, we also saw CHW's community health workers often be laid off or their programs closed. So we have this wonderful health equity workforce that works on all these issues that is not being utilized as well as it could be at this point. And so I really see that as a potential solution. Even for the question you were just asking, Justin, about how to reach and partner with communities. Community health workers as liaisons can help with that a great deal. And the outreach that they do can really create connections and educate people and inform and build awareness. So I think community health workers are a big part of the solution that we need at this time. So thanks.
Thanks for sharing that, Ann. And we're hearing that from other community health partners too. The program that I mentioned where we're repurposing funds to FQHCs, one of the things we're hearing about is they need funding for staffing support. And they specifically mentioned being able to hire back more community health workers for some of their community outreach. So the value that your team and your colleagues bring to the field is felt everywhere. Thank you.
Yeah, thanks.
So we've got Liz Moe raising their hand. Liz, would you like to, do you have a comment?
Yeah, thank you. My name is Liz Moe, and I am working as an independent consultant, but I've been involved in a lot of different funding initiatives in this community, the Twin Cities. And one of the things that I've been thinking about a lot lately is systems modeling and systems mapping. And looking at food systems, we did some of this with the food charter, the food network. And I've been working with homeless youth and also with arts organizations. And when I look at the categories, I challenge us to think of the whole system and not funding categorically, not having the money broken out in such a way that you can only look at food insecurity or housing. I was really struck by what Beth Becker said about how you feed and house young parents. Those things go together. And once you house young people, being able to help them sustain that housing when they may not have experienced that before, that all contributes to the education and achievement gap. So it's not that each organization needs to do one part of it, it's that somehow we need to work together and address these things in concert to support the people that are getting bits and pieces, but not the whole picture of support.
That's such a great point, Liz. Can I ask, do you feel like that is going to require a new or different infrastructure to coordinate all this? Or do you think it can be done with existing pipelines and infrastructure?
I think one of the things that makes Minnesota super special is our willingness to collaborate as opposed to compete. And I came up through the ranks of something called Comp Cancer at the state, where we were facilitating bringing people together and finding the resources that we already had within the system. So I think that I like to think that there could be a framework. I came from the Center for Prevention, and I know about the Constellation Fund. I like to think that there could be a framework that we could use with existing resources to help the funds go as much as possible specifically to community organizations.
That's great. Thank you, Liz.
Sorry, Leslie Huna has said that she has a comment. Leslie?
Hi. So what I do is I do housing stabilization services, and we have group homes that we fill. So what we're looking to do is, purchase more homes, either rent more homes from landlords that want to work with us. And then we literally go out on the streets and, find the people, see what's going on, see what their needs are. And then if we're able to put them in our, house, then they have food, housing. We work with them, on whatever their needs are, if they're trying to go to school, if they're trying to get a job, things like that. So we're just trying to, get started on that and And I feel that, since the highest shelter report, it's not really for more families, it's more individuals and youth, to kind of focus there and get them off the street first.
It's really great. Thanks so much for sharing that.
Yep.
I saw a comment in the chat that talked about reaching our BIPOC communities and being aware of historical impacts and historical trauma, which I think is also so incredibly important. I'm curious if folks have thoughts on how we can use that lens for the way that we structure this program or structure the outreach.
Yeah, I'm Amy Shong. I'm a planner at Ramsey County, and I wrote that because I'm working on racial equity, and we've been giving out grants to communities of color, BIPOC communities especially, and related to COVID-19 impacts. And right now, what we're hearing from community is that some community members are really nervous about the vaccine, and there isn't that kind of trust between them and the hospital or clinics. And so that, and also because of just the historical trauma that has happened to like the Black community and to other communities of color with how the medical field has treated them. And so I'm just thinking about how there needs to be more awareness or about the vaccine and in specific communities. And so, and even like, for example, in the Hmong American community, there's been conversations that the vaccine, this is all like about how government wants to really be a part of or take control of communities. And so some people are scared of taking the vaccine. And so there just seems to be, there's a need for education.
That's really great. Thanks for sharing that, Amy. I also wonder, listening to your experience there, if we need to not just focus the education outward to the general population of the communities, but also sort of upward to medical professionals and health professionals about how to talk about this and how to be sensitive to that. I wonder if that's not a focus that we need to not ignore.
Yeah, thank you for your comment. So let's call in one more person. I saw Beth Becker had a few comments in the chat box. Beth, if you don't mind coming off of mute.
Okay, I don't know if I have more comments. I think everyone's correct. We need to be working together. I think there are a lot of us working at this. A lot of the COVID funding coming out has been very random and fast and not thoughtful, and that's been difficult. So I'm hoping that in this particular instance, this seems already you've worked in these streams, and you've been thoughtful about that. You know what your goals are. At the YMCA here, we've been doing housing and supports for youth up to age 24, and with youth who have been involved in homelessness, in systems like foster care and juvenile justice and rescue from surviving exploitation and trafficking. And so those are youth who already have a lot of trauma in their lives. And so of course, COVID has just made it very difficult. And there's not a lot of housing for youth, especially parenting youth. So people who are doing housing, we do not own housing, but we do house youth where we can, and we work with the housing folks. Having the opportunity to shelter youth in hotels has actually been a bonus in this COVID time, because we are able to access, they aren't moving a lot. They generally we're couch hopping or, moving a lot. And so because they're in place now, they're able to get the services they need. And so that's been a bonus at this time. But we're also an organization that has a lot of reach. We have a state reach. We are into Wisconsin. We work with the Sioux YMCA in South Dakota. And so we have a lot of reach as far as getting information out to people.
Thank you, Beth. I think Megan wanted me to just elaborate on my comments that I made in the chat. This is Amy Shanafelt again. I'm sorry. I'll turn on my video. What I said in the chat was that in terms of funding strategy, what I've seen in the last year in my time working to fundraise for Appetite for Change is that the funding partners that offer long-term significant general operating support, along with a real true partnership from the funder that includes technical assistance for evaluation that the funder might want, certain numbers and metrics, and those things are really tough for community organizations to focus on when so much of the work goes toward programming, working with the community. So also to Liz's point, connecting into networks that offer resources in the areas where, the organization might not specialize, but that could support the work that the organization is doing, like wraparound services. And even, for example, if there was an effort to connect folks in the community to COVID vaccines, Appetite for Change, for example, wouldn't apply for funding for that because we don't focus on that. We can't stretch, we can't mission creep that much, but we would love to partner with another organization or with a funding partner that would want to support us in making those connections, because we know that that's so important. So just kind of, to everyone else's point, sort of these partnerships and connections and building networks through these long-term funding partnerships, and the funding being flexible because things change so rapidly. And when you feel like you're, sort of stuck in one area, it can be extremely frustrating and difficult.
Thank you, Amy. These have been incredibly helpful. Thank you everyone so much for sharing your thoughts. We know that we need a bigger community lens for projects like this. Is there anyone else that wanted to share a little bit before we move on to the specifics of the Social Impact Fund? Bill, I see that you just entered in the chat box. Would you like to share a little bit more with the group about what Stratus is doing?
Certainly. This is Bill Santerre with Stratus. Can you hear me, Justin?
I can, yes, go ahead.
Yeah, we just completed a survey of the 10 Minnesota health plans and really asking about what are the top focus areas for social determinants of health. And those were the top 4 that came up: mental health, food insecurities, housing instability, and substance use disorder. And we also asked about what are the key strategies that they're using or thinking about using for 2021 and going forward on the addressing social determinants. And the top 6 were using internal, external data sources, strengthening partnerships with community-based organizations, hiring or utilizing community health workers, including some of them are interested in setting up pathways, community hubs, supporting providers in implementing and utilizing screening tools to identify SDOH risk areas, supporting providers in implementing using e-referral platforms such as Now, Paula, Bertha, Unitas, etc. And the 6th one was utilizing community health needs assessments to prioritize and plan SDOH interventions. So those were, so we really we just are publishing it this week. And it's fresh information from the 10 health plans on where they're seeing in their memberships, their focus areas and needs.
That's really great. Bill, someone asked if you would be willing to share those 6 strategies in the chat box with everybody.
Sure.
Great.
Will do.
And thanks to everybody who helped share your thoughts around this. Again, these are invaluable insights into what our community is looking at and where we need to focus. You want to be mindful of our time, so why don't we switch to the next part of the conversation where we're going to have Max Gritzuk is going to talk about the Social Impact Fund specifically, how the process works, and what our goals are. Max, you ready?
Thanks, Justin, and thanks to everyone for sharing their thoughts around what you're seeing kind of on the ground in your community. Before we jump in, I did just want to respond to a comment that both Amy and now I forget the other person's name made around collaboration and partnership. And I think that's spot on. I mean, we recognize that these social determinants of health areas are in many ways interrelated, and we strongly encourage collaboration, and we welcome collaborative applications to this funding round. So that's definitely something I would encourage folks to consider and potentially explore as you look to put forward an expression of interest. So what I'm going to briefly talk about regarding the fund today is what we seek to accomplish, what we seek to invest in, how to apply, and then at the very end, I'll open it up to answer any questions you all might have. So just starting from the beginning, the Social Impact Fund was established to combat really two inequities that exist within our society: health inequity, as well as funding inequity. And so before the pandemic, really, as Justin articulated well, these issues of health inequity bubbled beneath the surface, but now these disparities are ever more present and really can no longer be ignored. And so the Social Impact Fund is addressing this by investing in community-based solutions to the social and economic barriers to health equity, with a goal of driving long-term, measurable, positive health outcomes over time. And in our approach, we recognize that no one better understands the changes needed in a community than the members who live there. And there is no one better placed to drive those needed changes. However, oftentimes access to capital is not created equal. And while there are innovative local solutions that exist within under-resourced communities, most, if not all, go overlooked and unfunded. So these same communities that experience the widest disparities in health outcomes are also the ones who lack access to capital compared with other communities. And so there's some stats in this slide that kind of illustrate the point, but just 2% of venture capital investments go to minority-led companies. Just 8% of private foundation grants benefit minority-led organizations. And so next slide, please. And so the Social Impact Fund is really seeking to change this through employing a nimble and flexible investment approach that is specifically tailored to support solutions and initiatives developed from within the community. In this particular investment window that you all attended the town hall for, we are actively seeking to invest in both for-profit social enterprises as well as nonprofits who are operating within the Twin Cities area with sustainable solutions to the impact areas that we discussed in the community needs discussion. So food insecurity, particularly access to healthy food and affordable food, housing insecurity, such as homelessness, eviction prevention type programs, economic empowerment, and lastly, reducing the education achievement gap. The types of investments we make through the fund are grants, low interest loans, and we also make convertible notes. Eligibility, kind of as I already mentioned, includes both for-profits, nonprofits, or even individuals. But the important thing to note is just that our priority is social impact above all, with a particular focus on scaling sustainable, community-led, evidence-based solutions. I'd say probably the most frequent question we get about this is how much funding groups should request. And while we can't just come out and tell you how much to ask for, or even give you a range, because then we'll just get a bunch of applications for the top. We can share that we have a total pool of $1 million, and we expect to invest in around 7 to 10 organizations. We'll also set aside a pool of capital for potential performance-based bonus payments at the end of the grant periods for the investees that are selected. But with that being said, we strongly encourage you to apply for what you need to drive the proposed impact and outcomes, rather than trying to size it to what you think we will fund. We also strongly encourage groups of all sizes to apply, especially smaller ones. For many of our investees today, we are either their first or their largest institutional funder. So if you haven't received grant funding from a larger institution like us, or even large grant funding or investment, whatever it may be, you're still perfect for us, and you're eligible for the Social Impact Fund. Another point I wanted to mention, which parlays into Amy's last question in the previous discussion, is that this is not just financial support that we're providing. We also provide advisory support and technical assistance that'll help build out our investees' infrastructure for growth and work to create the environment for the investees to flourish kind of long-term, well beyond our initial kind of investment or grant period. Next slide, please. So how to apply? So to apply for the Social Impact Fund, the first step is to submit an expression of interest for funding in our portal, which you can do using the link that's posted in this slide. I think it'll also be copied into the chat and probably sent out after this. It's also accessible through our website as well. The forum itself was intentionally created to reduce barriers to applying for funding opportunities like this, with a focus to bring in groups who don't traditionally have access to this type of capital. So it's extremely abbreviated, and what it's really seeking to get at is what the challenge is, what challenge the approach is addressing, the expected impacts, and what it costs. And really that's it. There's no hidden application beyond that. And so the deadline to submit your expression of interest is January 15th. And then from there, we'll schedule initial calls with many of the folks who applied. And the purpose of those calls are to serve as an opportunity for not only for you to articulate your proposals further, but also for us to ask questions to better understand them. You know, we're really looking to avoid this being something that you just submit and hope works, and rather it's the beginning of this collaborative process where in many ways, the onus is almost on us to formulate an investment opportunity around the work that you're already doing. So from there, we'll shortlist a group of proposals that will undergo a more rigorous financial and impact evaluation. And then we aim to make investment decisions by late February. And so just before I open it up to any questions you all might have about the fund or the process, I just wanted to recap what we're looking for. So our goal is to drive health equity by making grants or low interest loans to community-based nonprofits, for-profits, or even individuals with sustainable solutions to healthy food access, housing insecurity, economic empowerment, and closing the achievement gap. And the groups must be operating and serving residents within the Twin Cities area. And we're defining that by the counties that are listed on this slide. And we can share that afterwards if anyone has specific questions. But with that, I'd love to open it up to any questions that you all have. So if you'd like to do so, similar to the community needs discussion, please either type questions directly into the chat box or use the raise your hand feature located on the bottom of the screen, and someone on our team will call on you to speak. So I see one question in here from Amy, which is, when we say $1 million in total funding, is that for grants, or does that also include low interest loans and the other types of vehicles? The $1 million in total funding is inclusive of everything. So like I said, we can make grants, low interest loans, but the total pool we have to make those investments is $1 million. And it looks like Liz has a question. Go ahead, Liz.
Two questions. One is, how is it 1 million over a certain number of years, 1 million a year? Like, what's the length? And yeah, go ahead.
Oh, you can ask both. Sorry, I interrupted you.
Okay, the other one just left my mind. So sorry.
Okay, no worries. So great question. So you can request funding for up to 2 years. So typically 1 to 2 years.
And so would that be like July 2021?
So yeah, great question. So with decisions likely in February, I would think starting in probably even earlier than that, April to May 2021.
I know my
But you
question.
can propose something different. I would say that we would like the activities to begin right away. So if there's going to be some delay or a plan.
My second question was, is this model being replicated across the country in other communities, or is this just in Twin Cities?
Yeah, great question. This is actually a national impact platform we have at the AHA with this hyperlocal focus. And the Twin City region is either our 8th or 9th city. So we're already in several other cities throughout the country. Great question.
Amy Zhang had a question about whether there's a priority for organizations led by the people of the BIPOC community. And she's actually come off of mute if you'd like to elaborate on that question, Amy.
Yes, I just I thought I heard that it's for smaller, or you encourage smaller organizations and organizations led by people of color to apply. So I just wanted to know if that was something that you did say. And I was just wondering too about there are some groups of color that we know who are doing great work, but they are relying on like a fiscal agent. Now, is that something that would this be something that they can still apply for?
Sure, I'll take both those questions. Absolutely, we encourage small groups to apply, welcome minority-led, BIPOC-led organizations, social enterprises, whatever it might be. And we also can invest in groups that have a fiscal sponsor. So that's actually a question in the expression of interest form itself. So we'll just need a little bit of information about the fiscal sponsor, but that doesn't preclude you from being eligible.
Thank you.
Sure.
So Will Cooper has a question. Will all 4 areas receive the same consideration? And Will, I'm assuming you mean the 4 areas that were discussed, the food insecurity, economic empowerment, housing insecurity, and education gap?
Yeah.
Yes.
Sure, okay. I can take that. And I'm assuming by the same consideration, you're asking if simply we're looking to allocate the funding equally across the 4 areas, and the answer is no. We're looking to support sustainable solutions to one or all 4 of these areas, and we will invest in where, through speaking with local ecosystem actors and doing our own research, where the biggest area of need is and where our investment can be most catalytic and sustainable at driving the long-term positive outcomes.
So here's a question to stem off of Will's question, Max. Okay, never mind, we answered it. I was going to ask if there was one priority area over another, or if those 4 are being, or if you're just looking for the best solution in any 4 of those areas.
That's a good clarification, Megan. No priority. We're just looking for the best solutions, again, with the most buy-in from the community and the greatest potential to catalyze long-term positive outcomes.
Awesome, and I'm glad we were able to clarify your question, Will. Are there any other questions? I don't see any in the chat box, and I don't see anyone raising their hand.
Okay, well, we also have an email address that you can reach out to with any questions. I believe Megan put it in the chat. If not, someone will. And feel free to reach out directly to that email, and someone on our team would happily be available to respond or assist you as you look forward to putting an expression of interest in. But thank you, everyone, for your time. So if there are no more questions, I'm going to turn it over to Holly just to close us out today. Holly?
Hi, thank you. Can you hear me?
We can hear you.
Awesome, thank you. Well, thank you all for being here today. I really appreciate the interaction and collaboration just even on the call. Hearing what you're doing out in the community is such an inspiration for us to know and to know what's possible. And so thanks for being here. I would be remiss if I didn't mention the generous support of Gary and Sue Ellis, who made this Social Impact Fund possible for us in the Twin Cities. And I hope you all learned what you needed to today as you begin your expressions of interest or encouraging those in your community, your network to apply. We really are looking forward to bringing this to life in the Twin Cities. So thank you so much for being here. On the screen, you could see the link to go to learn more, heart.org/fund. And then, as Max mentioned, socialimpactfund@heart.org is where you can email questions if you have them. And just thank you all so much for the incredible work you are doing. Looking forward to making more possible for our community together. So thanks for being here, and looking forward to seeing you all in person someday in the near future. Take care. Have a wonderful holiday season. Bye-bye.